Good morning, my beloved student. I am Dr. Ghosh, Assistant Professor Physiology at Sakina Medical College, Jashore. Today, I will discuss first the functions of the respiratory tract or function of the lung. Okay, the function of the respiratory tract. Not only as you know, the respiratory system. Main function of the respiratory system is the gaseous exchange, no? That is a respiratory function, and there are so many functions not regarding the respiration. So these are considered as non-respiratory function of the respiratory tract or lung. So what are the non-respiratory function of the respiratory tract or lung? First of all, that is olfaction. You can smell something, you can smell of a food or delicious food or bad smell. That is the function of the respiratory tract, which is considered as non-respiratory function of the respiratory tract. Second number point is the vocalization. You can hear, you can produce some voice, you can produce sound by which portion? It is non-respiratory function of the respiratory tract. It is produced by the vocal cord of the respiratory tract. There is a vibration in the vocal cord in the larynx, and that will produce some sound, and that we hear thereby. Okay, so this is second point of the non-respiratory function of the respiratory tract. The third point is the defensive function, that is it will prevent the entry of the dust particle to the respiratory tract. So it will defend. It can be considered as whenever any particle will enter into your respiratory tract, you will sneeze, you will cough, and that will be expelled out. This is the non-respiratory function of the respiratory tract. And defensive function, that is called the defensive function. And there are so many regulatory function that will regulate by the respiratory system, that is it will help in regulation of the water balance, it will help in regulation of the temperature balance, it will help in regulation of the acid-base balance. Okay, so how they will help in regulation of the water balance? By inhaling and exhaling of the air. When they inhale air, while they intake air, they will also intake the water vapor, and when they exhale air or expire air, that will also expire the water vapor, and thereby they will regulate the water balance. And in this way, it also regulate the temperature balance. They will causes the regulation of the temperature balance. And the next point is the acid-base balance. How they will maintain the acid-base balance? By inhaling and exhaling of the carbon dioxide. As you know, carbon dioxide is an acidic substance. When it will retain in our body, they will produce respiratory acidosis, and when they will expel out from the body more, they will produce respiratory alkalosis, and thereby maintaining the concentration of the carbon dioxide, they will maintain acid-base balance. The next point is the metabolic function. So many metabolic function is performed by the respiratory tract. They help in formation of substance like prostaglandin, surfactant. Okay, these are the metabolic function, and some metabolic pathway they also considered. Okay, and they also help in formation of the angiotensin 2, which is produced by the angiotensin converting enzyme in the lung, and which is required for regulation of the blood pressure. So they indirectly help in regulation of the blood pressure. So these all are the non-respiratory function of the respiratory tract. And as you know, the main function of the respiratory system is the respiration, that is exchange of air and transport of air to the tissue and removal of carbon dioxide from the tissue to the atmosphere. Okay, and these all I have told you now, these are the non-respiratory function of the respiratory tract. It may come as non-respiratory function of the lung. Thank you very much today after this session. Okay, God bless you.